Hello, everyone. My name is Martha Alfaro, and I am a registered nurse student at St. Petersburg College of Nursing. This presentation will provide an overview of quantitative research related to safe patient care, workplace injury prevention, and the reduction of musculoskeletal disorders among healthcare workers. The introduction. This presentation will go over the significance of safe patient handling, appraise three quantitative research studies, relate their findings, and conclude with suggestions for nursing practice in future studies. Safe patient handling is a crucial component of workplace safety, especially since nursing has the highest rates of work-related injuries. The purpose of this review is to evaluate how safe patient handling interventions affect injury outcomes and identify gaps in the current evidence. Provided by Lee, 2022. Background. Musculoskeletal injuries are widespread in the nursing field due to lifting, repositioning, and transferring patients, which evidence shows that about 72% of the injuries are caused by patient handling tasks. According to Lee, 2021, safe and secure patient care is crucial job-related concern, particularly amid rising patient obesity and limited staff. Evidence-based training is essential to ensure workplace safety and foster a safe care work environment. According to Hidar Mahadam 2023, some methods that I conducted a structured literature search using CNOL, PubMed, and Medline. I also searched terms such as safe patient handling, musculoskeletal injury, and nurse lifting injury. All selected studies use quantitative methods and mechanisms to assess the correlation between patient handling practices and injury outcomes. These studies supply objective numerical data that is crucial for monitoring practice change. These steps helped reduce the evidence to the top three quantitative researches. Article 1 by Lee, 2022. The study assessed the impact of the California Safe Patient Handling Law on workers' compensation claims for musculoskeletal injuries related to patient handling. In this article, the sample consisted of workers at California hospitals. As claims were collected from 2007 to 2016, they measured employees who filed workers' compensation claims and had records, classifying them into patient handling and non-patient injury handling groups. Using a statistical modeling, they assess claim rates over time. The legislative intervention of the California Safe Patient Handling Law, the study showed that after implementing the new law on patient handling injury programs, there were a significant decrease in musculoskeletal injury rates. Nonetheless, underreported and debarring of federal workers could limit generalizability, provided by Lee at 2022. Article 2, according to Hidar Mahadam 2023, the study demonstrated that the impact of increasing patient weight on discern workplace strain, labor, necessitating special equipment and training. Musculoskeletal disorders is not well known, but studies indicate that manual patient handling tasks are a major contributor. This is why safe patient handling and transfer are ergonomic concerns in the healthcare field. Nurses cannot entirely avoid patient contact. Therefore, this article states that 72% of MSD cases occur among hospital workers. So, nurses must use patient handling equipment to reduce physical burden and complete tasks safely. Nurses also must consider manual patient handling, body mass, which studies show that the body mass of the patient increases the risk of musculoskeletal disorders. This study used a questionnaire and 249 nurses participated. Article 3, Lee, 2021. In this article, they found that nurses who worked in facilities that implemented safe patient handling programs reported better safe work practices, especially after California's safe patient handling law. The study showed that the safe patient handling programs implemented after legislation helped, but the use of lift devices and musculoskeletal systems varied across hospital. Despite policy advancements, the studies concluded that no meaningful increase in actual lift use occurred, indicating that limitations remain. Altogether, the articles supply the need for improved implications, equipment, tools, and training. However, safety equipment must be available and used for it to be effective. Some nurses reported strain when handling bariatric patients without the safety equipment devices, according to Hidar Mahadam 2023. Therefore, policy changes cannot be made in isolation nor guarantee behavioral change. Therefore, there must be a cultural, educational, and support system in place in order to demonstrate some progress, according to Lee, 2021. The research gaps present opportunities for additional evidence research to advance safe patient handling compliance and reduce injury rates in healthcare environments. Lee, 2021. Nursing implications. Nurses and leaders are obligated to advocate for resources and regulatory enforcement to ensure safety among staff. Nursing leadership must prioritize safe patient handling by providing safety equipment and make sure that it's available to all staff, and staff are trained as well to use it effectively. The evidence shows that equipment alone is insufficient unless paired with strong education and a workplace that is culturally included and supports the safe patient handling as well. Lee, 2021. Some recommendations. Preventative strategies and shared accountability can form a safe work environment. I recommend increasing safe patient handling training and training at facilities, especially hands on activities. Future research should focus on high risk units, for example, the ICU and nursing facilities that could benefit from lift teams to assist the nurses during patient transitions, according to ASCIO 2021. Conclusion. Safe patient handling care is expected to be crucial to workplace safety and to maintain continuous commitment and research. Also, safe patient handling programs reduce musculoskeletal injuries among nurses. So, implementing them in the facility will also improve musculoskeletal injury rates. Lee, 2022. Therefore, evidence indicates that using ceiling or floor lifts to minimize injury during patient transfers is the most effective approach to patient tasks. Frey and Davis, 2023. My references, ASCIO, Frey and Davis, Hidar Mahadam, references Lee, 2021, Lee and Harrison, 2022, and Socia in 2023. Thank you.